All right. Um, Hello. My name is Cinthia Magana Moreno, and today I'm going to present about measles and public health. Number one, public health problem is measles. That's what I'm going to be presenting on. And why does this problem exist in society? Measles can exist in any society because it's a contagious virus that doesn't discriminate on anyone. Except people obviously who've been vaccinated or are immune to it. It's highly contagious, can spread through the air and droplets from the nose, mouth, or throat of an infected individual. There is a latent period of 10 to 14 days once the individual is infected with the virus. Symptoms include high fevers, runny nose, bloodshot eyes, tiny white spots on the inside of the mouth, and a rash appearing on the face first, and then that will spread to the extremities of the rest of the body. Complications include ear infections that could lead to permanent hearing loss, diarrhea, pneumonia, and encephalitis, which is the inflammation of the brain, and both of these could potentially lead to death. There's also SSPE, which is a disease of the central nervous system that results from measles infection, but that's pretty rare since the year 2000, and here's just a picture of the virus in purple. All right, so how did this happen? Where did this virus come from? So according to an article by Nature magazine, the origins, which talked about the origins of major human infections, measles virus most likely originated with the beginning of agricultural methods 11,000 years ago. So as agriculture and human domestication of animals began, so did the evolution and conversion of animal pathogens into human pathogens. Measles is a virus related to the rinderpest virus, which is mostly infects cattle. In the US, measles became a recognized national disease that required reporting cases by healthcare providers. Where did this happen? According to the CDC, the first written account of measles disease was by a Persian doctor in the 9th century, a long time ago. In the US, mostly all children would actually acquire measles before they were 15 years old because before 1963 there was no vaccine for it. But since the vaccine came about, then the outbreaks began to decline. 2014 was the year with the highest reported outbreaks of measles in the US since 1996. There were 644 cases, and globally, measles is still common in Europe, Asia, the Pacific, and Africa. All right, and then what are the risks for the community in the future? Well, the risks are complacency. So since there's a decline of measles in many developed countries through vaccination, many people don't fear the disease as before, so they don't see the urgency in funding for immunization campaigns or even vaccinating their children. There's also fear vaccines due to a study made by Andrew Wakefield in 1998, where he pretty much said that there was a correlation between autism and getting vaccinated for measles. This was publicized, and later it was refuted by other major scientists, but regardless, it still left a lot of people fearful of getting their children vaccinated. And then in developing countries, it's the lack of funds and health infrastructures that's a risk that increases measles infection. What are the etiological factors? Well, in developing countries, young children, mostly malnourished with insufficient vitamin A or with a weakened immune system by HIV or AIDS or other diseases. Kids under 5 or adults over 20 who have been vaccinated are very susceptible. Also traveling abroad to developing countries in Southeast Asia and Sub-Saharan Africa, because this is where it's so common and can import the virus around the globe since people can travel around now and can spread the virus if they're not vaccinated. How to solve the public health problem? Well, according to the CDC in the US, it's required at the local and state level to have children vaccinated for measles as a requirement to attend daycare and school. So that's mandatory, and that's definitely a public health policy. Funds and personnel and vaccines are accessible worldwide. And one example is Pan American Health Organization's program to reduce measles outbreaks. And their program includes these strategies that begin with catch-up, which is when mobile teams vaccinate children between 9 months and 14 years for several days or weeks. And this way, children who miss their next vaccine dose acquired and gives a second dose to children who didn't become immune with the first measles vaccine they might have received. The second part of the program is Keep Up. So that is just implemented to provide routine coverage of vaccinations. And then the last level of the program is follow-up. So every 3 to 4 years, there's follow-up campaigns to reduce susceptibility in the population for measles. And that's just a map right there on the slide of countries affected by measles. How to solve the public health problem of measles. One example that I've already mentioned is the Pan American Health Organization's initiative to reduce measles, and this actually occurred in Latin America and the Caribbean in the 1990s, and it was definitely an effective program. The number of annual measles cases fell from 250,000 in 1990 to 537 in 2001, so definitely effective. Also, by providing mass immunization campaigns in conflict-torn countries and developing countries can decline the outbreak of measles. So one example is the Democratic Republic of Congo was able to decline their measles outbreak by vaccination of around 64% of their population. But this was only possible with the consent and willingness of both parties at war to stop fighting in order to have the immunization campaigns occur. So that was pretty amazing. And then due to immunization campaigns, Southern Africa has lowered their measles outbreaks from 60,000 cases to 117 cases by the year 2000. Lastly, public health in the future for measles. Well, what should be done to prevent the reoccurrence of the public health problem? In my opinion, and which is very apparent from research, is that vaccination is the best way to prevent measles. And one example is just here in the US in 1994, they launched the Vaccines for Children program that after there was a measles outbreak from 1989 through 1991, that policy actually declined those outbreaks. And then another strategy is just to dispel correct information about measles vaccines to the public, which also addresses fear of vaccines. So that's very important because in 2014, there was a measles outbreak in an Amish community in Knox, Ohio, and that led to many being infected. That led to many people being infected. And let me just open up my slide again. So that led to many people being infected because a lot of these people in this Amish community were afraid of getting vaccinated. So they had that misinformation about the vaccine, and then there was an outbreak there in that community. And as you can tell here from the graph, that definitely was an increase in 2014 of the measles outbreak due to that Ohio outbreak compared to other years. So yeah, and then this is my works cited page, and thank you for listening. Bye.